Hold your breath, everyone. Here we go. Another webinar, another day, another dollar. Right, good morning and happy Wednesday, everybody. As you're joining, if you could do the usual thing of putting a 1 in the chat to just let us know that the sound is working and you're all with us, that would be great. I think we're just letting a few more people in. Ones are on their way. Lovely. Thank you so much, Renee. Anybody else? Peter's back. Thank you, Joanne. Lovely. All right, great. Great to have so many of you here. Lovely to see you. We've got an extra special one for you today. Some new faces, apart from mine. Mine's very old. No comments to that one. Thank you, Joanne. But new faces and an incredible new platform of learning to talk about as well, which I'm excited to get to. But before I do, the usual role play, bit of housekeeping. Firstly, to say the call is recorded for prosperity and sharing, so you're not going to miss a thing if you need to drop off at any one point. Second of all, we love the questions, so please keep them coming in the chat as we go. We'll get to those as throughout the live call or follow up in the follow-up email with them. Firstly then, my name's Lucy Glynn, Community Manager here at Exxon Health. And with me today, new faces, the masterful Lindsay B, Product Manager for the Academy. Thank you for being here. And also a very active user of the Academy and who's been instrumental in getting us to where we are today with it, Mr. David Blake, Operations Manager at York Medical Group. Thank you. That was a very professional wave there, David. Appreciate it. You've been practicing. I'm really thrilled to have you both here today. It's great that we've got some new faces and we've got some stuff to talk about outside of Surgery Connect in its usual feature list. But before we do, I think it'd be worthwhile spending a little bit of time on introductions. I know we've got a lot to get through, but Lindsay, let's start with you. When did you join Exxon Health? What was your background and what have you been working on?
Morning, everyone. So I joined Exxon in December last year, so I've just been here around 6 months. I have spent the last 20 odd years in healthcare IT though, so I've got a lot of experience in the healthcare IT sector, especially around the learning element. So my focus has always been around customer experience and learning, e-learning. I did have a stint of 5 years in an e-learning organisation, so all the background theories and everything to do with learning on top of IT healthcare now is where I'm at. So the Academy, which we're going to have a look at today, is what I'm working on at the moment, which is bringing an online learning platform to all you learners, users, to help you look at the new features and the modules within Surgery Connect in your own time, really, a learner-led training opportunity.
Fantastic. I mean, you don't look old enough to have clocked up all those years in health tech learning, but aside from that, David, over to you. Could you tell us a little bit about, your day job, what York Medical Group looks like, and your role as operations manager?
Yeah, so we are a PCN in our own right in York, where we've got 44,500 patients across 8 sites in York, with quite a mixed demographic across York. I started working here in reception about 9 years ago, and I've worked in various roles as a lead receptionist, and then about 6 years ago started my journey in the IT for the practice. Was part of the team that rolled out and configured Exxon at the practice back in 2017, I think, maybe 2018. And then very recently, in the last 6 months, have become an operation manager. So I still lead on IT for the practice, but I also look after our medical reports, secretaries and scheduling teams. So not as much IT as I used to do, but still kind of the person that knows most about Exxon in the practice and how it's configured and set up here.
Interesting. Okay, so you're still the go-to man on all the knowledge for Surgery Connect, and you said 2017, I think, when you had it installed.
I think it's 2017. Yeah.
Can you remember that far back as to why you picked Surgery Connect, and has it helped?
Definitely. At that time, we went out in a formal tender process across the patch. Lots of us working together. And nothing was bespoke to GP surgeries. We were looking at systems like BT and others that offered call center technology, but it wasn't really bespoke to understanding the needs and the scales of GP practice and what we would like to do. And Surgery Connect was the only one that was really, in that field that understood what a practice would need rather than what a call center would need. Sure. It was very easy to make that decision once we'd met with Surgery Connect.
So for all those reasons, I'm going to assume it has helped, and we'll move on swiftly. Good. Okay. I guess today we are here to talk about the Academy, but I should mention, in fact, let's do one thing first. Anyone on the call who's heard of the Academy ahead of this webinar, pop a 2 in the chat. And that doesn't include you and David. Lindsay, all right. Okay, that's good. So there are a few out there. That's really positive. Not necessarily as many as I'd like, though. So we've got some work to do there, which is good, because that's why we're all here. So we are here to talk about the Academy today, but actually only one particular element of it. Because when we talk about the Academy at Exxon, it's important to say, I think, that it's a wrapper for all of our learning methods, which includes the on-site training that we offer. So it's designed to equip your team with the skills and knowledge needed to enhance operational efficiency, streamline processes, and ultimately improve patient access. But the bit we are going to tackle today in more detail is the e-learning platform, which is new to us, isn't it, Lindsay? And free to all of our Surgery Connect users. So this is the bit that David's been having a good explore of. And I know Lindsay's itching to elaborate, but one question for you, David, from me straight off the bat is, what's your experience been? Has it been a positive one of the Academy, the e-learning platform? And what's and all, how have you found it?
Yeah, no, it's been really easy to use. We've had a very kind of light touch and kind of getting set up. We know the support's there, but it has been quite simple to get users signed up and logged in and finding their courses. It's really easy to navigate around on the courses for the staff. We haven't kind of come across any problems at all. I don't want to ruin the Academy in case Lindsay's got things to talk about, but it's slightly unique compared to other e-learning tools that we've used in a good way. So the features and how it works are so much better. Staff have responded nicely to it. We don't have a great number of users using it at the minute. There's probably about 4 or 5 of us, but it's just because it's finding the appropriate people to use it for while trialing rather than not wanting to send it out to more. But it's all been a really easy to use experience, and we know if we needed any support finding things, we've been able to ask the questions, but we haven't really needed any additional support in using it.
Fantastic. Lindsay, do you want to dive in and ask your probing questions?
Yeah, well, just a bit of info first, really. I guess there's 2 types of courses available on the Academy at the moment. So there's these ones that you can see here, which are the post-training assessments. So any new customers to Surgery Connect, when you have your online training, afterwards you'll be pointed to the assessments here, and you can go on and just kind of check your knowledge, which is really nice. Go through a quiz and get a certificate and a pass mark at the end of it, which is amazing. And then we've got some more in-depth courses which are really nice around the features, the advanced features, and they've all kind of got a little bit of a nod to improving patient access for you. And we'll have a bit of a look at some of the features of those in a moment. But yeah, as Lucy says, it's free to anyone. The link is at the bottom here, so you can log on, have a look, get in there, register. Once you're registered, you can have a look around the courses that are there. You can also access it at the moment from the help articles, so the inline help that you have within Surgery Connect. If you go on there, there's an option to click on the Academy. So some of the courses are still in beta, but any feedback is always welcome, and obviously the work that David and some of our other pilots have been doing has been great. So we've got 121 students on there at the moment with an average pass mark of 90%, which is amazing, and that's without today launching it to you guys. So it's really nice to see people getting on there and having a good look. But yeah, David, I just wanted to ask you about the Academy itself. Have you got any favourite features that you would say have been really useful that are helpful?
Yeah, I think when you're looking at, especially when we're looking at the feature tools, so things like what you've got on screen, optimizing patient callback or using the phone bar, when you're going through the e-learning, it's very unique in the fact that when you're doing the videos, they don't feel like you're watching a video. It's very interactive, so your users feel like they're using the tool at the same time. They're having to click on versions of the items to be able to do the action to move along. So quite often, isn't it, we're very used to just moving through almost a PowerPoint presentation, screen through screen, whether it scrolls up or it scrolls down. They're not always the most interactive of services, whereas this makes the user actually use the kind of hand gestures and mouse clicks that they would have to use, which I think is really, really helpful. And they've definitely found, especially those that aren't competent in using the tools, that that's been a really useful way of looking at how we use this area, because they're having to click and drag into those areas, which is really helpful. And I also think the idea of, I don't know if it's on the screen, so I've had to minimize it a little bit for me, but being able to target different sections, so you don't have to do the whole learning course in one go, or all of it. If you don't need to, you can just investigate the area that you need. So you may have already had the experience on one part of the phone bar and you only want to learn about the new features, and you don't have to go for all the training to see that, nor do you have to do it all at once. You can, you know, dip in and out of all of those, so you can get these tick marks as you go along without having to actually spend a lot of time all at once completing the course. And especially, I think the reason we struggle is it's quite a thing to learn Surgery Connect, isn't it? To learn all the features in it, it's not as easy as just saying, okay, you spend a day working on that. There's a lot of intricacies, so being able to dip in and out is quite useful.
Oh, that's great. Thank you. Yeah, it was really important to us. I'll just show some of the features there. That there's videos that you mentioned are really interactive. It's almost like a simulation of the software. So we've just got a screenshot of one there where you can, if you feel like you say, you feel like you're working through it. It's very interactive, but you're getting the hints and tips, and the knowledge is being transferred to you as you do that. And the navigation, keeping everything, all the lessons into little bite-sized chunks was important as well. So like you say, you can just dip in and out in your own time. It's a lot more convenient. You don't have to do the whole course in one go and just get to the information you want. So that's really nice that you said that. Thank you. Some of the other things, just quickly, we've got some user stories on there. So when you're in a learner-led environment, it's really important to almost have a trusted voice there as well. So we're trying to include some talking head videos. We've got Prash here from Tudor Lodge Health Centre, and he just gives a quick 30-second video about the feature. So he's in our patient callback course, why he's using it, how they've found implementing it, and also a bit of endorsement about coming onto the platform to learn more about it. So that it's really nice to have those thread throughout. And we've got some formative challenges throughout. So rather than you just going through and getting all this knowledge, we just throw some questions in to test your knowledge, help you to embed it as you're going through. And then the icons, so here you can see the blue and the green icons there, used throughout all the courses to try and make it familiar to you. So as you do more of the courses, those items will become familiar. So the blue one there, as an example, is where we will call out information around NHS requirements. So the recovery plan, recovery and access to primary care plan, I always forget how to say that.
PCARP.
PCARP, yeah. We thread the requirement where we can help you meet the requirements of those PCARP details in the course. So there's lots of areas where we'll show you a hint and a tip, or give you some quotes from other learners, that kind of thing, to kind of make it more as engaging as possible. Because obviously when you're going through it on your own, it can become a bit of a tick box exercise, can't it, to just click through. So the more engaging we can be, the better, really. So that's really great.
It's just, I'm just going to elaborate a little bit there, if that's okay, because I've dipped in and had a little play with him, and you know, as somebody who doesn't use Surgery Connect on a day-to-day basis, because I don't work in a GP surgery, I found them quite fun as well. I think that's worth calling out, you know, because at the end of it, you get to sit a quiz and you get to test your knowledge, and then at the end of that, you get a thumbs up and what have you. And I think there's a real fun element to it that is worth calling out. I don't know if you agree,
nice
David.
And clean.
I think
Absolutely.
One of the big bits of feedback from a colleague of mine is that actually it's a safe way to learn Exon and Surgery Connect tools. So he's always very nervous about touching our Xflow. It's what can I accidentally delete by mistake or change? And he found it, a really safe way to learn to play with those features without having any impact on the practice. We know how to kind of take steps back if we've done something wrong, but I think if you're learning something or somebody's tasked you to do something, actually having a safe area to do it into like a test play zone without having to create flows that you're not going to use, kind of thing, to test them, was really useful for him. He felt more confident in that area, being able to practice, and watching it happen in front of him gave him that more confidence in Xflow. So it felt very safe. And I think both of us have really highlighted that it's a very different experience to eLearning than we've had before. It's it lays out so much nicer and refreshing to have something look different in front of you than rather than I said before, just that kind of almost PowerPoint presentation or scroll page. You know, it's all laid out in a very unique fashion. So it does take your mind a little bit to realize that you're looking at something different and that you've got to behave differently. But once you're using it, it's just nice and intuitive to kind of be doing it that way.
Great. So we've got all these nice features, but what would you say your biggest lesson learned has been when you've been running through the academy?
I think it's just being able to allocate that time, really, you know, to where do we find time to give staff for that. We haven't really been able to find anything that we struggled with it at all. Like I say, it's all been quite easy and intuitive to use. And I am always devil's advocate. I am a critical friend. So if I had something, I'd really share it because, you know, I want the next people. But at the moment, it was finding time and giving ourselves that protected time to be able to step away from our normal work. And I think for the people that would be involved in using the academy, that's the biggest thing that we will have a problem with. But in terms of all of it, signing up and using it was all fine. The only other feedback that we'd really got is about the quizzes at the end. Some aspects when you're using the tool, you've been used to using the tool within the training, but when you come to the quiz, it's actually worded answers, and you don't have the visual representations that you've had before. And the other feedback was that my colleague would like the emails, the certificates emailed to him directly rather than just getting a link to the certificate. But I think if they're the only two things that we can really complain about, it's not much of a complaint, is it?
Not really. That's good. The quizzes, that's definitely something we can look at because we can include more images in there. I know what you mean, because obviously we've kept it very engaging and image heavy and visually nice through the content. So yeah, we can pull some of the images through into the quizzes. I guess it just helps frame and put the questions in context, doesn't it? So that's good to know. I'm going to show the certificate in a minute. Well, let's show you it now, shall we, while you were talking about it. So the certificates, when you do the summative assessment at the end, so the full assessment at the end, there's a pass rate assigned to it, and if you pass when you've gone through all the questions, then you do get the certificate. So it's, at the moment, it is an email is sent to you, but just to say that you've completed the course. However, the certificate can be downloaded, so that's good to know how you're feeling about that, David. We can have a look at that. But yeah, these certificates are really great because they feed into your CPD points, obviously within the NHS. You can use it for that. It's a part of your learning in terms of the tech that you're using, so that's really great. And it's just good for momentum, I guess. It's nice to get a certificate at the end of a course, isn't it? You feel like you've got a sense of achievement, so that's really good. So David, what are your next steps with the academy? Where do you think you can go next with it?
So as I mentioned at the beginning, I'm probably the only person that really knows how to use Surgery Connect in its fullest at our practice. So it'll be a really good tool for us to pass on to our new system support lead that we have at the practice, and also to lead. So we've got reception contact center leads that work in our phone hubs, and they're really keen to use Surgery Connect more, but it's again a really good way to train them on the service without having to go and deliver the training ourselves. So they're not huge teams of people, they're 4 or 5, but I'm very much looking at it because we've had the service for such a long time. We haven't used the post training kind of aspect of it. It's the feature request that we'll be using it, but then once we've got new reception staff that join our phone hub, will be able to use it as a good way of getting them signed off to make sure that they know how to use the skills as well. And it just saves us having to use our staff in all that training with them. We'll be able to kind of delegate it to this tool, which is really handy, but hopefully then take some of the worry stress off the practice that I'm really the only one that knows how to use it, and give it to some more people, and that we can all be upskilled at the same time. But yeah, that'll be the next steps for us.
Oh, that's good to know. Yeah, it's really nice that staff can go on there and go through it in their own time, have a look. I mean, it can be used in different ways. It can complement the training that you've had already through us at Surgery Connect, or like you say, your in-house training, or it can just be that foundation block, I guess, that you know that everybody's got to a certain level, and then you can build on top of it. So eLearning is really good for that. You can use it in lots of different ways. It's entirely up to you with it being learner-led. So it's just another option, I guess. Anything else? I was going to ask you which stuff do you think would most benefit from it, but that was really.
Oh, sorry, I tried on that one. Yeah.
So that's good.
We haven't massively rolled out the phone bar yet across all of our staff. We've used it just in our contact center. So that would be, again, a really good bit to give everybody as well. So once we roll out the phone bar in all of our machines for all of our staff, the phone bar featured bit would be really good. So there's definitely more than just the people that answer the phone that we can use it for. So yeah, that would be the one after, but that's on us getting to the phone bar kind of aspect for everyone.
Yeah, the ones that are on, so obviously there's the phone bar one on there, which you'll get to. There's a patient callback feature. There's one on reporting and data analysis at the moment, and then there's the post-training assessments, and we're currently working on one around call routing. So the course is taking a slightly different format in that we're threading a scenario through it. So because obviously call routing can dips into lots of different features within Surgery Connect, we didn't want to just say, and this is how you do this bit, and this is how you do this bit. We wanted to have a real tangible scenario, I guess, that we work through. So the next course that we'll be bringing to you to have a good look at is all around following a scenario using the different options within Xflow, using check and cancel, using personalized call routing, SMS messaging, and all with that theme as well of how these different features can help you to meet those NHS requirements that we mentioned before. So yeah, that's an exciting one that we're working on at the moment. So look out for that. And like I say, anybody can access this. I know David and there's a few others are actually piloting it for us, but it is out there in its beta format. So any feedback that you want to send us, get on there, have a look. We're totally open to that. We love to hear what you say. We want to make it work for you. So yeah, please go on and have a look.
100%. I think that's really worth saying, and I have popped the link in the chat as well, just so that you can go and look at it live, I guess, and see what you think. We'd love to hear your feedback. We'd love to have your questions in the chat as well. And just before I get to one question that's popped up, is it the case then that as new features come out, there'll be new training courses put on the Academy? Is it a constantly evolving system platform?
It is, yeah.
This one's for you, Lindsay. Yeah.
It is, yeah. So we've got a list of courses that we're working towards. We're trying to keep up to date with the new features that are available. So obviously the patient callback and check and cancel that we've told you about on previous webinars. So there will be courses around the new features. There is a focus on access optimization, so how we can help you to beat that 8 a.m. rush, I guess, and different features that we can use within the system to do that. And then long term, we're looking to have a user area. So when you join Surgery Connect, you obviously go through the user specific training and then the supervisor management style training. We're going to have nice landing pages for each of them with all the different elements that make up what you need to know in that user role, if you like. There'll be a clinician specific area as well, so that when you log on, you can go to that area and you can see all the different options. You can click on the one that's relevant to you, and then even dig deeper and just go to the specific area of that course that's relevant to you as well. So we've got lots of plans. We want to have hints and tips on there. We want to build a community almost, Lucy, which I guess you'll help us with in that we listen to what you want. We help you to share knowledge and best practice, and we can bring hints and tips into here so that you can collaborate and learn from each other. That's the big plan.
Which I think is magical news for David as well, because that was something we talked about before joining the webinar, wasn't it? So exciting stuff on the roadmap, I think, and it's good to see how it's evolving at speed. But lots to do, because as you say, the features keep coming thick and fast. And I think it's also important to just mention, because obviously what we talked about here is the e-learning platform being a part of the Academy. And it is brilliant, I think, is the message I'm getting through for building confidence in the system and the features that make your job as a receptionist or practice manager or a GP better and easier from an operational point of view. But I think it's also important to say you're not on your own. We have still got your client relationship manager. There's still a whole team of people available from a training perspective that can come to site and help you, walk you through the system in a real hands-on kind of a way. So it's a really good foundational piece, the e-learning platform, but it's not the be all and end all. If you don't want to do that, help is still at hand. There is a question in the chat that relates to excuse me, how we might promote this a little bit better. So it's a good one. It's a good question, probably one I'll pick up with you separately, Pavel. I hope I've pronounced that right. But he's asking, we have many new users in Kingston. Would you like me to promote it to our new surgeries? Yes, please do. Absolutely. I'll take that one. Do you need any ambassadors to promote it locally? Absolutely. That would be a really, really positive thing, because the idea of this, and the reason it's free to all Surgery Connect users, is that now you've got your systems and they're in place, you've got some great technology. Let's help you to use it to its full capacity. And that's the premise for the Academy and the reason we're doing what we're doing. So just to recap, I think, Lindsay, it's probably worth answering some simple questions. When's it coming?
Well, it's there now. Definitely go on and have a look. It's the link is there. It is also, as I mentioned, in your help screen. So when you click on the help articles from within your phone bar or on your SSO, then there is a little menu option at the top that says the Academy. We'll obviously be pushing it more, like Lucy says, in terms of socials and getting it out there, but yeah, go on there now and have a look. There's the caveat is on there that they've still got beta in the name, some of the courses, but that's just because we're still getting feedback from some of the pilots. But yeah, go on, have a look and let us know what you think.
Fantastic. And equally, I think if there's any feedback in terms of courses that you'd like to see or information that you'd like to be put on there, it's the usual route. So product@x-on.co.uk, and they're a really responsive team. So make sure that you do that if you've got anything to contribute. I think for the first time ever in the history of me being on these webinars, we're going to finish on time, guys. Thank you ever so much for being here, to Lindsay and David. It's been really informative, and I'm really excited to see where this e-learning platform goes, and likewise the wider sort of Academy piece. But I think that's it from us today. So thanks ever so much for being here, David. I really appreciated it. We hope everyone has enjoyed it and you've got some information out of it. If you'd like anything further from anything you've heard today, or anything that is burning in the back of your mind, please speak to your customer relationship manager or the training team. We're going to make the recording available and share it. Thank you, Peter. Thanks to everyone saying thank you. Appreciate that. We'll make the recording available in the next couple of days. I'll send it out in a follow-up email. In the meantime, on behalf of the whole Exon Health team, great work, Karen. Well, there you go. You got one sign up already. Have a happy and healthy May, and we'll see you next month for more. So thanks ever so much. Bye for now.
Thank you, everyone.
Thank you.